when you think about exercise, exercise in a normal state is a good thing. Is exercise in a deuterated state a good thing? No, it can kill you. That's the kid's story in Akron, Ohio. And I want people, my critics think that I'm anti-exercise. No, I'm anti-exercise because I know all the patients are fucking deuterated. That's the real problem. And then why do these guys push creatine and peptides? Because they're all deuterated and they get the short-term benefit, but they don't understand the long-term risk. But I'm seeing the long-term risk come in NBA players that come in and they can't move their body. So we have a lot of people right now that get a small injury. And I'll tell you the last one that just happened. Some kid named Mason in Akron, Ohio. He played a baseball game and did real well, had no problem during the game, goes home 3-4 hours later. He gets horrible nausea and starts puking. Then immediately 2 or 3 hours later, he goes brain dead. And he gets transferred to the children's hospital in Akron, and the doctors, were impotent to fix him. So this is the reason why I'm bringing this story up to you, because how can a normal, healthy kid go from playing a baseball game to locked? And I'll explain it to you really quickly because it's gonna actually affect, I think, the patients that you see. What do you do when you play baseball? You're doing a lot of metabolic activity. So if you're doing a lot of metabolic activity and you're already deuterated, what are you doing? You're destroying a lot of the nanomotor engines in the ATPase. So what was the sign that something was magically wrong? His CSF vortex between the third and fourth ventricle is connected by an aqueduct. If you know anything about the aqueduct, it's long and skinny. That's called the Venturi effect in biophysics. It's designed to speed the vortex up so it pushes the deuterium out, and the center channel is all H plus. Well, what happens when the center channel is filled with D plus? It hits the floor of the fourth ventricle and makes you puke. That's where the chemotactic center for vomiting is. But the problem was the doctors that took care of him in Ohio, they didn't know this. Okay. So why did the kid become brain dead? Was he really brain dead? The answer is no. He was completely locked. In other words, his water table became so deuterated everywhere, his muscles, his brain, that when the neurosurgeons came and evaluated him, he looked like he was brain dead. So this is happening in a lot of places in the United States right now. And you hear these doctors, there's especially one doctor that really